leaving the army or leaving a career and trying to essentially start another is really hard. And I've seen colleagues, some non-military, but a lot military, finding that transition extremely hard with struggling with your mental health, because you're starting a job already on the back foot, saying, I get stressed at things. If you don't really wrap me in cotton wool to begin with, I might not cope. And you think, oh, I have to be perfect. I need to be 100% fit in order to start that job. And how are you ever going to get there unless you're in the job already with somebody, the confidence that your team are going to support you? So I got put back in on a graduated return to work in a non-pressure job working in cardiology. So I was supernumerary, an extra person, and totally wrapped in cotton wool. I had this wonderful consultant who was my mentor. And he said, if you need your hand held, I'm going to come and see you at the end of each day, and I'm going to talk to you in the morning, every morning, and if you want to walk out, you can walk out. If you want to cry, you can cry. That was key, but that was an investment, because they put faith in the fact that hopefully I'd come out the other end and actually, continue my career.
So tell us a little bit about why you think mental health is important.
Obviously we've all got, our physical health and our mental health. And I think it's easy to, focus on physical health and looking at other people. And if we think about people being unwell or injured or disabled, it's about, we think about physical injury because it's easy to spot and easy to see and easy to identify with, easy to talk, easy for people who are not injured to talk about. I think mental health is difficult for a lot of people to talk about, whether you're suffering with your mental health or low mood, depression, but also on the flip side, for people who don't have mental health struggles, to understand what to say, how to support somebody with their mental health. And I've seen it on both sides, both as somebody who's struggled with my mental health on and off over quite a number of years, and as a GP as I am now. When I was younger, it was almost a taboo to talk about mental health. It was an embarrassment. My family wouldn't talk about it, and people generally didn't. If you wanted to join the military or join the airlines or join the police or any kind of jobs where, I guess it was to do with weapons, but a lot of safety or safety jobs with, public safety, and, you were reluctant to talk about it because, you had this impression that you would not get a career or you would lose your career. And there wasn't a lot of awareness and a lot of proper understanding. So it's a relief now to see nowadays in the media, and a lot of people, including celebrities, famous people, inspirational people, are talking about their own mental health because it normalizes it, and I think that's the key. I'm not sure that many people go through life without having a wobble or a low patch or a significant episode with depression. And it can feel very isolating, and it can feel as if you're the only one and nobody would understand, and, being too scared to talk to other people about it. So it can feel lonely and isolating, as the nature of, anxiety or depression is. And then, that can play into all of our insecurities, not good enough and a failure or, that kind of thing. And then telling somebody else, the fear of being judged. So with this more exposure to talking about mental health in the mainstream now, at schools, on TV, just on the internet, is great, because I think it makes people feel a little bit more comfortable opening up. and there's more of a encouragement for people to do that, and for people to be more aware of their friends and to just keep an eye out and for the, and be supportive of friends. I mean, we know one of the main causes of death in young men is suicide, and that's tragic. And a lot of the research around that is about people feeling uncomfortable to talk about what they're worried about, to talk about their stresses, to feel they've got the confidence to reach out for help, or that there is a solution or help is out there. And I think equally applies to women. Men's are often more successful, and that's why the suicide rate is higher. There are an awful lot of women who struggle the same and attempt suicide, and that is really hard. And I have my own experience of that personally. And then obviously an awful lot of experience as a doctor.
So when did you feel that you could start talking openly about your mental health?
Openly, as in to other people, was a long time ago when I got put into compulsory counselling at Headley Court, and talking to that social worker and verbalising actually what was going on to somebody. And then that allowed me to recognise that I wasn't well, and accept going on medication, so an antidepressant. Because again, at the time I was embarrassed, it was a taboo, and also it was a threat to my career because I was still in the military, and I couldn't fly on those medications. But that saved me. It was important. I needed them. It made the difference, and I needed that support. And it being, it enabled me to talk more and try and work out what some of my triggers were, to declines in my mental health.
And what advice would you give to someone listening or watching who is maybe struggling to open up? Because it's really showing immense vulnerability to actually openly talk about your mental health. So what would you say to them, or what advice could you give them to help them find that confidence to talk?
I think, you're guaranteed support. For example, if you go and talk to, your GP, or if you go and talk to anybody, a clinical medical professional, nurses, counsellors, anybody who's trained to support you, that's an easy first step in some ways, because they're going to not judge you, and they have probably heard most of it before, so they're not going to be surprised by anything you say, and they've got the advice and resources and things to support you. I think with other people, we've got friends and family. It's surprising. I think I was always surprised. I first talked to my physiotherapist at the time when I was on antidepressants, and I was quite embarrassed, and didn't know what to say, and I told her, and she just said to me, "You'll be surprised once you tell somebody you're on an antidepressant, because everybody will start opening up that they've been on them before, or this, something." And I did learn that over the years. It's really common, and a lot of people are very empathetic. So possibly, asking somebody about their mental health, how have they coped with stress, or being down, because we've all been through that. And that might make somebody else who's maybe a little bit further along in their journey to open up to you and say, "Oh, actually, I had a really dark period in my life," and then you've got the confidence that they're going to understand when you say, "Oh, actually, I'm feeling a bit like that too." So maybe approaching it that way.
So if you're having a bad day, who do you go to, or what do you do to lift yourself out of that downward spiral?
I personally find like reaching out to. I've got a few friends that that get it. They know me. They know I'm pretty open. I'm wearing my heart on my sleeve. They know me, so I can kind of reach out and say, oh, having a bad day, not feeling great today, and just doing that helps. They'll message back. I think just being open about it. I find getting outside, that's my eternal struggle, getting out of bed in the mornings, because we often feel worse in the mornings. But once you get up, that's good. I've tried all sorts of techniques. I have a cat.
What do you do to get up? If you have a day where you wake up, you think, I really just don't feel like getting out of bed today. How do you get over that? Because you say you're going to feel better if you do.
Yeah, I know.
How do you get over that initial hurdle?
Well, I mean, I'm going to be honest, some days I don't. It's not easy. But I find booking stuff in. So if I've ever got an appointment or I'm coming flying, or, you have any kind of meeting or something on a day off, I make an arrangement in the morning, because I know that's me up. If I'm meeting a friend, meet in the morning. Like I say, I got a pet, which made a world of difference. And I live on a boat, so with lots of ladders and things, so I couldn't get a dog, which might have helped to get me out for walks. But I got a cat, and that puts an instant smile on my face, because I live on my own. So that's good. I have to get up to let him out or to feed him and things like that. Just incorporating things that get you out or get you up, because it's easy if you don't to then just sort of think, to ruminate and stuff. Some of the other techniques, I know I'm better if I exercise, or I'm outside. So, yes, I'm physically able, so I can go swimming or I can go cycling, but doing something that just gets me outside in the fresh air. So even just going for a short walk, or just opening the door and sitting outside in the sunshine, I find that really helps. Or just seeing the sea.
So you found what works for you.
I found what works for me.
And that's the key message, I think, for anyone listening to take away, is it's to find what works for you. So tell me a bit about, you left the army, and that was on mental health grounds, is that right? Mm-hmm. So tell me a bit about your journey from leaving the army into then retraining as a GP. So
I got medically discharged with recurrent depression, which was a difficult journey in itself. Accepting that and trying to fight it, but ultimately that's what happened. I left in, say, the August. I applied. I'd been to see a careers coach, a medical careers coach, to say, what can I do? I've got this medical degree. I've qualified as an SHO, junior doctor. I'm now out of the army. I don't know what direction to go in. Don't know if I even want to do this anymore, because it was stressful anyway, being a junior doctor, ignoring any of the thoughts of the pressure of, military stuff. And I had recognised that night shifts make me ill, and that is a thing. Occupational health took me off nights and said, you never need to do them again, because this is not good for you. We're never going to make you do them again. We'll make you ill otherwise. So we did personality questionnaires, we did all sorts of work trying to look at where, what I was passionate about, what kind of things suited me. And I sort of got directed reluctantly towards GP. Not something I ever imagined doing, not something I ever wanted to do.
You hadn't thought of it, it was something that you were...
I'd never thought of it as an actual option, no. I'd thought about it and thought I definitely don't want to do that. But it got explained to me that your way of thinking is doing things that are difficult, that are things that are under pressure. You are good at those things, but are you good at those things because you've just practiced them a lot? and that's what you were doing, you know, with the military, with flying, it was numbers, it was fast thinking, it was at fast speeds. Is that why you're being put, you know, your brain thinks I need to do like anesthetics, I need to do emergency surgery. Is it because that's actually good for you? Is that because that suits your personality? Or is it because you think you're good at that and that's what you've always done and you think you have to be under pressure? That was a big question.
It is, because it's sort of really getting to your core values. So you're good at this, but is it because you practice it and does it make you happy? Does it align with your core values? Or are you doing what you feel you should be doing rather than deep down what you want to do? That's quite a moment.
Yeah. And I trusted the process, and whilst, you know, it's still a journey of working this out, but I trusted the process. GP, you know, we looked at what would suit my life. You know, working less than full time was important because when I get fatigued, my mood drops. So working part time essentially, and a training program, a medical specialist training program that would allow that. Having regular hours instead of shift patterns, not being on night shifts. So trying to take away the things that, you know, trigger me, and being in maybe a more friendly, supportive environment. So yes, weighing up the pros and cons, trying to stay in medicine, but
in a way that works for you.
Yes. No, you know, the percentage of depression in GPs is higher than it is in any of the other specialities.
Is it
they
really?
think, yeah.
What is the percentage, just out of interest?
I think it's they say about 25% are on antidepressants.
And why do you think that it is higher in GPs than other specialities?
Because I think essentially because of the isolation. You know, in a big hospital, you're in a big team. So you've always got people around you. And yes, there is noise. And yes, there is incessant beeping and alarms going off. But you are a part of a team and you have access to a lot of investigations and answers and advice and things like that. So there's less uncertainty. You know, GP, you know, we know how difficult it is to get a GP appointment because everything's so overstretched. So, you know, you're in a room and yes, you're seeing people constantly, meeting new people all day, but not, you know, you're under pressure with each one to make decisions with a lot of risk management and a lot of uncertainty. And, you know, the majority of people we cannot send to the hospital. That's the point in GP. So, yeah, there's a lot of pressure from that point of view. And I think, and the isolation of not being around your colleagues.
I guess because you don't really get to build connections with the people because the GP appointments are so short.
Yes, and
have meaningful connections.
And as they get shorter, because we need to fit more in, and as they become more telephone appointments, you don't have that personal connection. So your job satisfaction goes down. So, yeah, I mean, that's a whole nother conversation about primary care. But, yes, so that's why I went into it. And also because you get the range, you know, you don't get just, you know, one type or demographic of patient. You know, I see babies, which always puts a smile on your face. You know, little kids, teenagers, adults, and elderly, and people at the start of their lives and people at the end of their lives. So you get this lovely variety. And over time, you do get to build in a connection when you see people, you know, back and bring them back. So that, you know, that is nice. So, yeah, that was the...
So is your journey into becoming a GP?
Yeah, but from a point of view of mental health, now I was very lucky because leaving the army or leaving a career and trying to essentially start another, although I was already a doctor, but is really hard. And I've seen colleagues, some non-military, but a lot military, finding that transition extremely hard, with struggling with your mental health, because you're starting a job already on the back foot, saying, I get stressed at things. If you don't really wrap me in cotton wool to begin with, I might not cope. And you think, oh, I have to be perfect. I need to be 100% fit in order to start that job. And how are you ever going to get there unless you're in the job already with somebody, you know, the confidence that your team are going to support you? So I was off for a year from leaving the army. And then I started, I lasted 3 days. And then I became very unwell and ended up in hospital. So it was a short stage of doctoring. I was off for 6 months. I went back to work in a different department, which unfortunately it wasn't particularly well chosen for me. It wasn't my choice. And I went back into working in psychiatry and covering the unit that I had been a patient in recently. So not ideal. So that lasted a couple of months. That was a bit too triggering, and I was off again for a year because there was this big push. You have to be fit to be back as a doctor. You know, a lot of other jobs maybe I would have been able to go back to sooner, but so then the key for me now was my next job. So I got put back in on a graduated return to work in a non-pressure job working in cardiology. So I was supernumerary, an extra person with no expectation and totally wrapped in cotton wool. I had this wonderful consultant who was my mentor, and he just held my hand. And he said, if you need your hand held, I'm going to come and see you at the end of each day, and I'm going to talk to you in the morning, every morning. And if you want to walk out, you can walk out. If you want to cry, you can cry. But being given the permission to do that and knowing that I could do that meant that although I did do that, it didn't last very long because it just felt so supportive. And that was key. Because it was really hard. It was really frightening. I would get all these and I'd just have to walk out, or I'd get upset about something and then I would just go home. But they kept saying, that's fine. It doesn't matter. You're not letting anybody down. Any work you do is fine. It's a bonus because you're just an extra person. And for the system to allow that was, you know, that was really beneficial. And I was in a lucky position to be able to go through that. But that was an investment from, I guess, you know, the NHS or junior doctor training to allow that, because they put faith in the fact that hopefully I'd come out the other end and actually, you know, continue my career.
It's just interesting hearing that story. As you talk about equity versus equality, and the equity is, so if you've got, say, 3 people that want to watch a football match or look over a fence, equality is giving everybody the same height box, but that doesn't really fix a problem if they're all different heights. But equity is giving people that tailored support and what they need, which is what this consultant did for you.
And which didn't happen the first time, didn't happen the second time, but he was spot on and got it right. And I guess it is, you know, that has given me faith that, you know, yes, everything you try is not going to work, and other people might not be the right support for you. So, you know, you reach out to somebody and you get a pushback. Not everybody's going to be like that. Like, he was the key person for me who was that support. And it took a while to get there. And probably wasted 18 months of my life. But it doesn't matter because we got there. And actually with that amount of support, you know, I was back functioning as the same as my peers, as a junior doctor within about 3.5 weeks. So, you know, and it was a 6-month job. So, you know, I came out of it with an awful lot of confidence. You know, to then get back into the rest of GP specialist training.
But it's also persistence from you, though, and determination to actually just keep going and keep finding that support, like the right support that you need. So just what could you share with our listeners about how you just kept going? Because it sounds like it was really challenging, you know, starting something, and then particularly in the psychiatry unit where it's, you know, really, really triggering, but you still kept going, you know, with your medical career. So what did you draw on?
It's hard, isn't it? Because you get a knock, if you get knocked back from somebody else, or I got a knock back from my mental health. I tried my best and I still became unwell and ill. And then how do you have faith that you're going to recover again? And are you setting yourself up for a fall by going back into it? Because a lot of people questioned, maybe medicine is just too stressful. Maybe it's not the right thing for you. I think part of it is stubbornness. Part of it is a deep-seated, cynical but optimism that I have, that surely things will get better. And then reinforcement, positive reinforcement of that, because, I have met, some really wonderful people who have supported me in all different areas of my life. And the more people like that you meet, or the more opportunities you get, the more it reminds you that when you're in a bad place or in a bad situation, or work is not working, or a situation is not working, that there is another situation that will. So you don't have to stay. You don't have to stay in that. I didn't stay in the ENT. I got on well. I didn't stay in the psychiatry job. I eventually have got to, I had another job a couple of jobs after cardiology. I didn't like that much, but they were okay. And then we had COVID, which put a lot of stuff in perspective, I guess, for an awful lot of people in the UK, including myself. And that was...
What was your experience during COVID then? Were you working in a hospital at the time?
COVID was heartbreaking. I personally didn't lose any of my own family or close friends, so I was lucky. I worked in acute medical unit to begin with. I became unwell with COVID. I was off for a few weeks, which was frightening at the very, very start of it all. And then I worked in elderly care for 6 months, and it was heartbreaking every single day. Losing patients every day, not knowing who was still going to be there the next day, and spending most of my time on the phone to relatives explaining, I think this is, your relative is very seriously unwell and may pass away, or phoning them to break the bad news that they had. And to do that day in and out, in something we didn't have a lot of control. Before we had the vaccines, we had little control over it. We didn't have a lot of understanding about COVID. So all of that was very hard. It was basically a survival thing for all of us.
But you were in a point where your mental health, you had enough resilience to be able to provide that really crucial service to your patients.
I did, yeah, I did. And as I say, some of that was getting that experience, the year before, and having supportive people around me and my colleagues. It was a strong team in the jobs that I was working in that job, and then in a palliative care job I did later during COVID. So we supported each other through that.
It's incredible resilience, actually, seeing that and dealing with people dying, having to break news to their loved ones. Do you think the Catherine that left the army would have been able to do that?
Not at that
point, no. So it's an incredible story of you building your resilience through all the steps that you took to be able to work during COVID.
And I think having your own struggles, I know there's a positive in that. I see it most days in work, because anybody who's gone through their own struggles in any way can understand somebody else's struggles in something similar. So, I was already a bit of an empathetic person anyway, but, my mental health struggles, I know I can support my patients, with theirs. And, with COVID and those kind of things, again, it's just another experience. We all learn from the experiences, and families learn from each other, patients learn from each other, clinicians, we all learn from each other. And then as a whole, to just look at what is important in life. I think we all had a reset after COVID and realised a lot of stuff about jobs and what's important in life, and is money that important? Is family more important? There was a lot of kind of positive stuff that came from a very, negative situation.